Afternoon, everyone, and welcome to the Systems and Sustainability Echo brought to you by Be Well Texas. My name is Andrea Roche. I'll be facilitating our conversation here today. Just a little bit of housekeeping before we get started. As you notice, we are recording these sessions and making them available after the session on the Be Well Texas YouTube channel. Any info you put in the chat, though, will not be shared on the recording. I have just a little bit of administrative stuff to get us started here. Please do stay muted unless you're speaking, and we do encourage everybody to speak today. If you've joined on a computer, navigate to the mute or unmute button in the lower left corner of your Zoom controls, or if you're on the phone, press *6 and wait for the loud voice to tell you you're unmuted. We do encourage everyone to join by video for the discussion portion of the sessions, but completely understand if you're not able or comfortable to doing that. We're just happy you're here, regardless of how you join. We do ask that since there are a lot of us here, you use the chat, as many of you are already doing, to help us with attendance. Please enter your name, your affiliation, and your email into the chat. But please do know that throughout the course of this session today, no protected health information is allowed either in the chat or in our discussions. Just another note, if you are a Be Well Texas provider, make sure you identify yourself during this session. And especially if you're joining on phone, make sure you email that phone number and your name to bewelltexas@utesca.edu. Echo IT is going to put that link or that email address over in the chat in just a moment. Towards the end of the session, keep an eye on the chat. The Be Well Texas team is going to send out a link to an evaluation survey so that you can tell us a little bit more about your experience here today and give us some suggestions for shaping this series moving forward. And if you complete that survey, you were also entered into a drawing to win a $30 Walmart gift card. So please do it. It doesn't take more than a couple minutes. I do want to note, unfortunately, our didactic speaker for today, Nick Zubak, had to cancel due to a conflict. We've rescheduled him to present at our October session, and Lesley Manson, a member of our hub team, has graciously offered to present today's didactic on best practices in management of efficient billing and data in health organizations. So following that, we're going to have a case presented by Christine. All right, so we're going to start our session now with some introductions of the hub team and our presenters today. We'll follow it with those didactics I mentioned, then some announcements from the Be Well Texas program and case presentation and open discussion. Thanks again so much to all of you for joining today. We encourage you to view yourself as a teacher, view yourself as a learner, and share your experiences, your perspectives, and your insight into today's conversation. So let's introduce the hub team. We'll start with you, Lesley.
Thank you so much. Hi, everybody. I'm Lesley Manson. I'm clinically a licensed clinical psychologist. I've worked within primary care practices for over 20 years. I do lots related to practice transformation, related to integrated care and substance use and other types of diverse programming to support our whole person health outcomes. So I'll just limit it to that for right now, and I'll open it up to everybody else. Kathy, you want to go ahead and introduce?
Sure. So good afternoon, everyone. Or morning as it is there, I guess. I'm Kathy Hudgens. I'm a consultant, so I do program building, typically in integrated care and substance use treatment. I also do quite a bit on policy and workforce development, and I am a delighted member of this hub team.
Thanks, Kathy. Matt?
Hi, everybody. I'm Matt Rose. I apologize for the less than optimal video. I just lost all my power here, so I had to hop on my phone. My background is in clinical social work. I was a clinician for a good number of years, agency administration as well. Then spent a good amount of time doing governmental planning, and have been doing consultation now full-time, working in a number of different environments, mostly in the areas of process and quality improvement and best practice implementation. So good to be with you all.
Thanks, Matt. Adrian?
Hi, everyone. Adrienne Lindsay, Director of the Center for Substance Use Training and Telementoring here at Be Well Texas. My background's in integrated care, and most of my work has been focused around implementation of evidence-based practices.
Thank you, Adrienne. And certainly, last but not least, Andrea. She may have muted herself. Well, Andrea is the terrific coordinator who helps bring all of these sessions live for you. Please do reach out to her if you have any questions about presenting a case. All right, let's get right into those didactics. Lesley, the floor is yours.
Okay, I want to make sure, does everybody see the presentation fine?
Yep.
Wonderful. And you can hear me okay?
Yep.
Okay, good. Thank you, everybody. So as a reminder, what we're going to be talking about today is management of efficient billing and data in healthcare organizations. And I'm going to review some of the best practice pieces. I want to remind everybody that I don't have any real disclosure of financial interests here for this. And I'm going to go over some of our learning objectives really briefly. So throughout our kind of 20-30-minute talk right here, we're going to talk about some essential strategies for successful fiscal planning. We're going to identify other types of healthcare financing strategies and techniques that you can use related to substance use, integrated care, billing, and data management in specific. And we're going to appraise and identify some quality metrics. Okay. Now, mind you, I only have about 20 minutes, 30 if I extend it. So some of the areas I'm going to be a little brief and give some information. There is lots of information to dive into, and each of the areas I might talk about, you could also do a focused talk. So please let us know if you're interested in any of these areas, but just much more focused. Also, please feel free to be interactive. If you have questions about anything that I bring up, please let us know so we can go ahead and put your questions and comments in the chat box. So one of the things that always comes up for most programs and organizations is making sure that we can be fiscally sustainable. So how can we long-term demonstrate our sustainability and ensure that? Well, there's lots of steps to this, including making sure that from the beginning, we're aligning all of our kind of mission, our programmatic mission, our organization definitions, all of our services are aligned related to fiscal sustainability. So really taking the time to do this. And I'm going to walk through some of the stepwise processes related. In addition, as we look at aligning, we have to look at direct alignment related to financing metrics, our scope of practices, and how we're actually building our teams. And if we're doing this as kind of a quality improvement measure, I'm going into an already established organization, I'd be looking at doing the same thing. Okay, so I'd actually go in and look at the already identified teams, already identified scopes, and wanting to do this alignment. So we're going to dive in a little bit and talk about that alignment even further. But just noting that depending on where you are, okay, and your location of care and the type of program and organization you are also means the type of value and sustainability that you're going to have opportunities for. So just to define that even clearer for you is that your states and the federal government in the United States define what types of opportunities you have and you're eligible for related to billing or related to value-based care opportunities. So please know it's really important to know some of your state rules and regulations related to that, and obviously the federal opportunities that are allowance for you. So as we move through, it is important to look at your organization and your programs as a whole. So we always go back and say, again, what is your mission for your organization? And then you'd want to really look at that and think, okay, well, what type of programs, services are we actually providing for our community? Who is our community? And so we want to look at it in a variety of different ways. So one way to look at that is horizontally across all of the populations and people we serve. What are we providing for care? What are all the ways we're doing it? Who are all the different team members in play? And then we're also going to look at our targeted services. Perhaps there are specific things that we do that are only for isolated members of our community that we serve. So we want to look at those very specific programs and define them very clearly. This could, if you're already an established organization, maybe looking at specifically your job descriptions or your programmatic descriptions and really marking them off so that you can have clear definitions about who you serve and what types of services you're providing. That's going to help you when you start to build your fiscal sustainability and your overall planning. Okay? But one problem that always comes up is it a collections problem? Is it a billing related to that? Or is it a planning problem? What is the most common problem when it comes to fiscal sustainability? Well, I would say it's usually a planning problem for most organizations. We end up being very, very responsive to our communities and wanting to react and provide services. So most organizations come from this ground up working where they identified a need and problem and built an amazing program off of that. But while they were building it, they obtained funds here and there as much as they could. However, they didn't do that process of standing back and really developing a fiscal strategy and plan for the organization. And that's where we want to look at really changing. If it's billing related, Okay. It is important to know some of the common errors related to billing. Okay, so I just want to point that out. There are common errors. People constantly call me every week with questions like, we billed this code and we're finding last month 130 people we didn't get reimbursed for. What's the reason? Well, there are most common errors for reimbursement, and you look at them all right here. And basically, they're just coding, simple coding and documentation errors. And I might reference it as simple, but truly you do need to take the time to review all of your coding manuals and make sure you understand how you're intended and required to code at your organization, the type of organization and the state you're in. Okay? So taking the time to do that, that's part of really building a sustainable organization, making sure that all of your players and staff members know how to document, making sure that's all set up for you related to that, connected to your billing. Okay. So all these are parts of it, and these are all individual pieces you could actually build quality improvement projects off of. Is it an authorization problem? Is it a registration problem, right, with billing? So really knowing those basics is extremely important. There are a lot of billing codes in integrated care, and I'm just using that term broadly. So to provide services in a variety of different ways for our communities. So I wanted to give you some of the main codes just to kind of do a shout out to them in case you're an organization that is interested in putting in and implementing direct service and care and wanting to make sure you have the right codes. So I gave folks here a view of some of the most common codes utilized across the United States. There are peer support service and recovery support service codes. Those are specific in each state because some states allow for billing, some states don't. And so that you'd really want to go ahead and look at your state, including for promotores, peer recovery personnel. So again, you'd have to look at your state codes related to that. Case management can also be billed. And again, depending on your state, will define what that's going to look like. There's care coordination billing and coding. And when you look at these codes, if you're an organization that doesn't do direct billing or doesn't do it yet, you might also want to consider, again, those horizontal and vertical services you provide. Perhaps you're an organization that can provide contractual services to another organization that can provide the billing. So what you're going to do is provide the personnel, the staff, the program to be able to do this for another organization. They may bill that, and then they're going to pay you for that contracted service. So really thinking through, that's why it's so important to know what your services are. So here's some more most common billing codes. So just looking at substance use programs and really making sure that people understand the codes really are large and vast. So making sure that people also recognize things like you want to do STI screenings, pregnancy tests, TBs, et cetera. So making sure you get all of the codes that are available in use for you. Okay. I also included the medical and psychiatric codes here, so folks have an idea of those. Sorry, my clicking got stuck there for a moment. So quick coding knowledge, when you're looking at those codes, if you're wondering what are the easiest ways you can get the information on how do you code documentation is really truly through the coding guides. So they're all available. Most coders and billers already have them. They have those big books. We used to call it the bug books, right? So there's a bug, you want to grab the book and drop it. The really big books of coding, they actually outline the CPT books, outline all of your requirements related to it, which is wonderful. They're also available online now. So most coders and billers have all of the CPT guides online and to be able to use that. You can also do some good old-fashioned Googling and find that information online too. If you don't have access to those guides yet, and you're really starting at the base, please know that CMS provides all the information related to their requirements online, so you can get all of their information. And all of your private insurances also provide the information. What's going to be hard is you might have to do some wait times on the phone to call them and talk to them about it. Okay. So one of the things I always really reinforce is really taking the time to do the 5 steps of sustainability for your organization. And I'm going to go over those now really briefly for you. So the 5 steps are knowing your healthcare institution, site license legalities and understanding, your site type, your payers, your provider license type, your workforce needs, and your service delivery and coding business case needs. So we're going to go over those really quickly here. So step one, understanding your legal requirements. When you're really looking to build sustainability in your organization, you want to look at what type of organization you are. So what are you licensed as within your state? What is the actual business license that you have? And then know what you're eligible to provide as far as for services under that license in specific, and whether you're legally able to bill or have expansion of your team members. There are actually some states that require, if you're going to bring on substance use services or behavioral services or medical services, that you add an additional waiver or a note in your state. So you actually have to apply to Medicaid and say, I'm going to do this extra waiver, or I'm actually going to do this form to provide this other service area. So you really want to know those, so you always can ensure that you're meeting your requirements and nothing gets kicked back later. Okay. There are many programs across the US who did not do this and then were audited years later after being paid for years, and the state took back hundreds of millions of dollars. At that time, you get to negotiate, but still, you don't want to find yourself in those types of situations. Okay. So some of the ways you can find that out is just by calling your state or looking at your licensing. It's all defined on the state level on the websites. You can also Google things called the Office of Administrative Counsel rulemaking to really see, and then make sure that you don't have any required waivers for your state. Okay. And you can also just contact other organizations like yours that have been successful in your area and really talk to them regarding how they set it up and make sure you're set up to be sustainable related to that. So then you know what you can do as far as who you can hire, what services you can legally provide, and whether or not you can provide different types of billing and get reimbursement for those. So then the next level is your site type. So you have your license by the state and then your site type. So are you a type of nonprofit organization? Are you an ACO, an FQHC, an RHC, right? What type of organization, hospice, might you be? And there's many different types, but if you qualify for a certain type of designation, especially federally, then you're actually qualified for specific types of other types of funding, as well as value-based opportunities. And so that's a really good thing, is to just double check to see if your state has value-based opportunities for you based off of your site type, or if the federal government is giving that to you. Okay, so that's going to dictate your eligibility on other types of monies that you can bring in. Okay. It's also going to dictate your regulations and rules. So some of those actually require you to have things like patient-centered medical home status, things like that. They also tie into what types of metrics you're legally required to be reporting. And so that's also important to know. So all of that will tie into your ability to be fiscally sustainable as well. Stakeholder communication is another step. So this is where you really want to meet with your community, meet with your patients, meet with your other organizations that are providing services like yours or that need services like yours, as well as your providers internally, especially if you're doing an internal quality improvement audit. You want to meet with everybody and really just check in. Are we meeting our needs? What are we missing? How can we expand? How can we grow? And then really look at what you're doing. Sometimes organizations are very surprised, even when they do an internal audit and they find out they've been providing services that they could have been billing for all along. And they really had no idea, at least maybe management didn't, right? And so really doing this dive with an eye on the sustainability is really important, because then what you want to do is, from every line of what the definitions of as far as the job descriptions and the service lines are, every single element should be tied to financing. How are we financing this? What? Food closet. How are we financing this? What? This line of group services. How are we financing opioid prescriptions? How are we financing what? So every little item needs to be actually tied to a financial structure. So going through the community is really a great way to do this. That also means contacting your payers, because there's stakeholders in this too. So making sure that you outreach to them and really have the time. It also might mean multiple phone calls, I will warn you, to the payers to ask them questions about different types of services and whether or not they will bill them and how. You may have to get a sit down with them. Medicaid services are usually really good about that, scheduling sit down meetings so that you can actually walk through your program and talk to them about it and see what you're eligible for and what you're not eligible for. And then your specialty private insurances, you'll have to do that via phone. Sometimes you'll have to call many times and get on with managers to be able to figure that out. Okay. But it's taking the time to do these steps are really important. Once you know all of that, and these are done in order, Once you know all of that information, then you start to look at your workforce and you say, so now we've got all these information from new services that we know what we need to do, things that we want to do, things that we've been doing and we need to bill for, and we should be billing for. And now we need to look at our providers, our service team members, are they qualified to do it? Let's look at our team. Do they have the knowledge to actually do this? So if we're now going to bill for a service that we've been doing, are we actually doing the documentation correctly to meet that need, right? Are we having the things, supporting our workforce in a way that we can actually maintain our sustainability? Because if we put these things in play and we don't look at our workforce needs, then it won't be sustainable. We won't actually be able to keep it up. So we need to look at infrastructure related to EHR, okay, our best practices, our training, etc. We also look at making sure that if there's anything else that we need, that we're able to talk to our professionals and really bring that up and build it. Maybe it's internships, maybe it's CE development. It also means making sure that we develop different types of documentation and coding strategies that are very easy, templates in our EHR, verbiage and scripts and marketing related. And then finally, once we have all that information, we're really going to put it together in a business case and development. So we're going to take that information, all those lines that we drew from every line of service, every single job description, and we identified how each of those are going to demonstrate a fiscal return in some way, whether it's cost savings to our organization or whether it's direct reimbursement or money's being generated in some other way, grants, fundraising, etc. So once we've tied all that together, then we're actually going to use some sustainability tools, some financial tools that organizations use to make sure that we are able to maintain and monitor our success long-term. Okay. So there's lots of different tools that we can use. Okay. Some of those, I'm going to show them right here for you. One is called a Performa. It's actually a very easy tool. There's lots of examples that folks have. I have many. They're also available online free. It's a method of calculating current or projective fiscal results. So you can look at it to actually dive in and see, what are we doing now? It's usually done in an Excel document, and it pulls in how much money you're generating and how much money you're paying out to maintain your services or your organization. You can do them for each person, or you can also do it for each program, or you can do it for your entire organization, or all of the above. So you can have multiple performas for one organization. So one demonstrating every single actual job description, and then one for every program if you'd like, and then one larger one for the organization. It really helps with your planning, looking at what is our actual return, okay? Are we making more money? Are we losing money? Is this one person helping to bring in and save money for the organization? And how are they generating stability and money in other ways? Okay? So it really helps to do that and elucidate it for folks. You want to look at financial incentives and value-based care. And that's all going to be set up related to your metrics. And we're going to go over metrics in a little bit. But all of that you actually have to do with some mathematics. You have to demonstrate all of this. And if you really want to look at even sustainability with other types of grants long-term as well, those are all now requesting things like performas and direct ROIs and cost savings analyses that are built into your programs. So those are also tools that you can use. So if you've never seen them before, there's actually very easy equations that you can use to demonstrate your direct ROI and your cost savings. And if you've never done it for your organization and you're worried because you keep seeing budgets and books, but you don't really know the full ROI, then I would encourage you to actually create one and go through the mathematics. Okay, they're very quick. It's the same structure. It is the gain from the person or the program. How much money are you getting in per year, per month, per day, right? Minus the cost of that program, organization, or person per year, per month, per day, okay, right? And then you divide again by that same number, the cost again. Okay, very simple calculation, very simple structure, but it does take time to build the information that goes into that. It does take time to figure out how much does someone cost, right? It does take time to figure out how do we get our money and where, and how long do we have for that money? How long do we sustain it? So that we know the timeline for our ROI. You can also look at things through a cost savings, okay, generation. And if, again, you're looking at really demonstrating your value, especially to other organizations that you might want to team up with, get contractual services for, gain grants or other types of revenue generation or charitable organizations, they really love it when you can demonstrate through performas, cost savings, or direct ROI equations, because you can clearly see what you're providing and what's happening in your organization. So cost savings is the calculation is actually the cost savings divided by the standard cost of a program. So what you might demonstrate is how other programs work and their costs, what yours look like. So you minus that. That would be the cost savings. And then you divide that based off of what other programs do. So then you show how you are actually a better, more efficient, and more effective program based off of cost savings revenues. You can also look at this if you're trying to recognize the value of one of your personnel and really wanting to make sure to demonstrate and show, hey, this person is actually someone who's helping our organization with cost savings, and this is how. So all of these equations can be worked in as an organization view or as one certain person looking just at their job description and tying all of their areas of the job description to fiscal sustainability. So understanding your value is really important because value, of course, is always looked at when it comes to finances, right? Because they justify, can help with growth. But we also need to look at the outcomes. We need to know we're doing this for a reason, right? It's not just finances. Yes, we need to keep the doors open, but we're doing this really truly to serve our community. So we need to have our outcomes, so our data, our metrics, because all of that is truly tied to our financial rewards. Okay, it's tied to benchmarking and maintaining, and really truly for sustainability. It's going to demonstrate our value, and that can speak lots more to other organizations, other opportunities for contracting, and of course for billing. It's now part of lots of required contracts for billing. Lots of Medicaid across all the United States have already transitioned to value-based purchasing as a partial part of your payment services. So, and Medicare already is. So it is really important if you're doing billing to consider that. Private insurance already is transitioning. So you'll see many of these things happening. So where do you get your metrics and how do you define that? Well, you don't need to make them up. You can, there's actually ways to do that, but you're most likely going to be required to use metrics that are nationally supported. Here are all the different areas that most people have to look at nationally supported metrics. ACM actually has some specific ones, and your state entities will have some. So your state entities will also dictate some very specific metrics for value-based purchasing, especially related to behavioral health, substance use, and primary care services. When you're looking at the metrics, they span very specific categories. Like they span from like population health categories. So that's ED, biometrics, disease prevention, morbidity, mortality, to standardized metrics, as we just noted, that can span a variety of areas, to model specific things like warm handoffs, access, wait time for patients, communication, especially if you're looking at care management types of metrics, or organizational like satisfaction. Okay. I'm going to show you in just a quick look, and I'm going to wrap up here, but I'm just going to show you some of these metrics in case many of you haven't seen them before. Okay, I'm going to show you a few of them just to kind of look, oh, here's some metrics. So here's some metrics that CMS requires, okay, of organizations, especially if you're going to be looking at billing and sustainability and utilizing CMS services for that. We're going to take you through some of the NQS, National Quality Forum metrics. They have metrics. Now, National Quality Forum is actually backed by CMS as well in the US government. And it's typically metrics that organizations that fall under FQHCs, ACOs are required to do. Okay. Same with NCQA. You also have the HEDIS metrics with that. All of these, I focused on substance use metrics. So you'll see that all of these are substance use, just to give one focus for everybody. There are hundreds and thousands of metrics depending on your populations and your services and service lines. So you always want to get the metrics that are very specific to what the services you are required to provide or you're providing for your community. When you can demonstrate your outcomes in these ways and really show, hey, we are doing this and we're providing this based off of these national standardized metrics, and we're doing even better than other organizations, it gives you that step up. It will make you more qualified in lots of ways related to being able to negotiate higher rates and values for yourself. People forget if you're a billing organization, you can negotiate for higher rates, as well as it can be helpful to obtain other types of fundraising contracts, negotiations, and of course, grant applications. Okay. I'll go through a couple more, and then I'm going to pause to check in to see if there's any other questions. And I know we want to transition to a case as well. So you can see there's Medicaid specific. Okay. And there's lots of the metrics are actually shared metrics. That's the easiest one for people to target. If you're wondering, which one do I target? There's lots of them. Target the shared ones, the ones that multiple facilities utilize, multiple larger federal agencies and organizations nationwide have said, these are the ones that if you're providing that type of service, you should be demonstrating. Okay. And that's really important. And remember, there's actually peer recovery metrics. There's metrics in almost everything you can consider, communication metrics. So it is important to really look into it and dive into it if you haven't already. Because then you could also help with establishing those contracts to other organizations that are required to report these, but perhaps aren't doing well, or perhaps don't have the personnel, programs, or staff to do it. Okay. So there's even a Pharmacy Quality Alliance for opioid measures from NQF, for those of you who have services. Okay, so just clicking through. Behavioral care. Okay, again, these are only a taste. There's even more. Okay, CDCs. So there's lots of metrics, even more. But overall, what you really want to do to build that sustainability, okay, and we could do almost a talk on each level of these different items, but you need to really look at taking a step back for your organization. Really consider what is our organization, how we're working, how we're operating, and measure and align all of those pieces to it, okay? I'm going to go ahead and stop here because I know I need to and open it up to Andrea. Andrea, go ahead.
Thanks so much, Lesley. And Adrienne read my mind with what she put in the chat, but if you're not seeing it, we will circulate these materials and the recordings also available as well after the session. So I know there was a lot of information on those last few slides, but just to give you a taste, and we'll certainly follow up with the details. We did have a question, actually, Lesley, first in the chat from Bianca. When we talk to insurance to verify, what do we need to obtain, if anything? What, where, how do we need to document?
Yes, when we talk to insurance to verify what we need to obtain. So yes, so what you want to do. So whenever I call an insurance company, I think it's funny. I call them at least twice. So just so you know, so that's at the very least. So I always double check the information they're giving me, because just because you receive that doesn't mean it's valid. Also, when I get that information, I ask them, where is that information in the provider manual or on your website? Can you email me that information? I also do not hang up. And I had to learn this because they did it to me lots of times. Took me a long time to learn this. Don't hang up, Lesley, when they say, I just emailed it to you. They even be like, let me double check your email. Does that sound accurate? You hear them typing. I never get an email. Like hundreds of times this has happened to me, right? Never got an email. So that was my mistake. So literally I say, I'm going to wait on the phone with you until I receive that and double check that is the accurate information. I've even gotten emails that were like something completely not what we spoke about. And they said, that was all the information. So you stay on the line, you ask them where it is truly documented, because you need it in their writing, in their manuals, in their context. And they have it all, okay? And then they will send it to you, or they need to tell you where it is or give you the email, the address. So you search it up at the same time, and then you have it, you ask for their name, you write it down that you spoke to them, their name, that they gave this to you. This is, sometimes they'll have badge numbers. I just got rid of that. I just get their name and info. And then I write down the websites, because I'm verifying with the hard information. I don't care too much about the people, because honestly, when I've called back with misinformation, nobody cares related to who you spoke to. Usually they just want to correct the misinformation you got and, and want to verify it. So I do call again usually, and I'll ask one more time about, is this all, is there anything else? And just double check, because again, you might get another set of information. This will happen a lot if you are contacting different types of insurances, especially if they're over multiple states, and one, they might forget you're in the Western division, or you need this, or maybe you need 2 divisions worth of information. So you really want to do that clarification. Okay. Does that answer it? Or is there anything more related to that?
No, I certainly appreciate that. But also though, where should this be something that's documented, like perhaps in an administrative note in CMBHS, or documented in our medical record that the verification was obtained or anything?
So yeah, you typically just want to document the management side. If it was a verification related to services you're already providing or specific patients, then you can note that on their like insurances or on their practice management side of your EHR, wherever that patient information might be. So it might be a level that you do there, but otherwise it's really for your own clarification to make sure you've got it done right and you fall back on it, especially if they come back and don't pay for a service. So sometimes even large insurance companies make mistakes, and sometimes they'll pay for things that they're not supposed to be paying for, and they will not pay for things they're supposed to pay for. So you always want to have that information so you can go back and double check things and correct it if needed.
Awesome. Thank you so much.
Yeah.
Persistence and endurance and details. That's boils down to that. Any other questions for Lesley? Well, if those bubble up, as they might do, as our case is a bit tied to this topic, please do feel free to throw them in the chat or unmute and share them. Before we get going with that case presentation, I do want to share some updates from the Be Well Texas program. Mark, when you're ready, if you could share those slides. So Be Well Texas is a welcoming environment with caring professionals ready to help people start or continue their journey to recovery. Be Well Texas is committed to expanding equitable access to compassionate evidence-based treatment and care for substance use disorder all throughout Texas. Next slide. Bit about the Be Well Texas Clinic. Oh, are we on that next slide yet? There we go. The Be Well Texas Clinic provides high quality treatment for addiction, offering insurance, self-pay, low cost, and no pay options. Please visit bewelltexasclinic.org for more information about that. Next slide. As I mentioned at the beginning, we did have to reschedule the presenter originally scheduled for this month. So thank you all for your flexibility. Please do join us next month for that rescheduled presentation on how neuroscience is changing addiction policies. Next slide. And the next brief buprenorphine training is going to take place next week, September 28th at 3 p.m. So this is a 10-minute training directed to all providers, medical students, and emergency personnel. For more information, just go to the Be Well Texas org website, or IT is also going to drop that registration link in the chat. Okay, let's move on to our case presentation for today. Christine will share the information you shared with us, and when you see it up on the screen, please tell us more about the situation. Thank you. While we're getting that pulled up, Christine, you can go on and start. Introduce us to yourself and tell us a little bit more, and Mark will have that pulled up in just a moment.
Okay, great. Hi, everyone. I'm Christine Zimmerly, and I'm a peer recovery support specialist, recovery support peer specialist, a re-entry peer specialist, and an intentional peer support specialist. And I'm one of the project coordinators for Project Punto de Partida at El Paso Alliance. And what we do at El Paso Alliance, it's a nonprofit organization. And we provide in-reach support services to those that are incarcerated. We provide institutional support. Within the institution, we provide aftercare, harm reduction, outreach recovery support. Sorry, I'm just having a little bit of trouble with my computer screen here. Okay, 1 second.
No
Okay,
problem.
Thank you. Okay. So we provide reentry recovery support to those who have been recently released from jail or other institutions, and harm reduction outreach recovery support. We provide harm reduction supplies, overdose prevention supplies and trainings, recovery support to our community free of charge. We have a food pantry and office, and our center has an office for coordinated entry as well. We partner with many community organizations to offer the services that we provide. We are a recovery community organization, and so almost everyone who's employed by the Alliance, the El Paso Alliance, is in recovery from substance use disorder. We transport to appointments, we pick up upon release and transport from release from jail. And we offer referrals to community partners for mental, physical, and spiritual well-being. We provide residential recovery support and supportive sober living. We provide transportation to doctor's appointments and warm handoffs to referrals. We provide connections for our participants for their well-being to include recovery support. Our desired service outcome is to reduce recidivism and reduce harm to individuals for our community. Our desired outcome is to remove stigma, including reducing the harm to ourselves by finding a sustainable funding source for our program. Our desired outcome is to provide a sustainable connection to the recovery community for those who are seeking support through any healthy pathway the person chooses. We have our desired outcome as an organization is to place our talented staff in positions of their choosing so their skill set can be utilized to its fullest potential. And our desired service outcome is to be able to provide recovery support services to all who request it. We're a nonprofit organization, a 501c3. We're a harm reduction center, recovery community organization. A 24-hour crisis support is available, and reentry recovery support and peer reentry advisory council is available for those reentering from incarceration and institutionalization. The sustainment challenge is financial models, which thank you for answering so many of those questions, Lesley. Sustainable funding is a problem that we are facing. We get funding for a certain amount of time, and then that funding ends, and so we put all the resources to try to close out the program for that funding and try to seek out additional funding, and we don't have a plan. We don't have a very solid plan. We need sustainable funding to provide reliable long-term recovery support program for our participants who are building a peer reentry advisory council, which will aid them in supporting one another. Our challenge is that as a nonprofit organization, we're funded through grants which have end dates. We have a number of people we expect to serve and have far past that number to have people waiting in the jail for services. We do not have enough sustainable resources or staff to supply the need that has come from our local jobs for recovery support. And that means that we have a lot of people waiting to be serviced. One of our main concerns as a nonprofit with sustainability is funding. One of our main concerns with reduced recidivism is continued engagement after release. Upon release, our participants need education, housing, food, utilities, and are faced with the barrier of seeking employment with a criminal record. While in jail, there is a limited access for participants to recovery support services as well, especially those with a violent history. We are receiving far more referrals per day than we can accommodate, and the number of coaches that we have. And the resources we have currently are not allotted to provide in jail services. We apply for grants that become available, and many of our community partners are on the lookout for where we can secure additional funding. We receive funding and sometimes it ends, and we transition to a new program, and we're doing the best that we can to continue our efforts. The top 3 key strengths that our team brings to the effort is that we are well trained in motivational interviewing and person-centered approach. We're passionate about recovery and helping others to find their pathway to recovery. And we have lived experience, and we can share our experience, strength, and hope with our peers. We seek funding opportunities and apply for them, and this, of course, is helpful. We continue to move forward no matter what, and we've gotten creative about certain things. We are discussing with the Reentry Peer Advisory Council how to do fundraising and what to do in the event of recurrence of use. We have discussion topics within advisory council, such as financial management, coping skills, communication, and fundraising. We have a local justice leadership council with which we attend, and the peer reentry advisory council also attends, to look for opportunities for support and continued growth. What would be the best indicator that you successfully resolved the current challenge? It would be an indicator that we successfully resolved this current challenge if we had sustainable reentry recovery support funding. It would be an indicator if we were paying enough, if our staff did not have to work 2 or 3 jobs to make ends meet. It would be an indicator that we successfully resolved this challenge if we would consistently offer to support to the Reentry Advisory Council and to all of those who are seeking it. What specific questions do you have for the hub or members of the learning community that may help you resolve this challenge? What is the way to find sustainable funding for nonprofit organization? And I think that I got some good answers, or at least some good starting points from Lesley in the presentation a little while ago. And that's it. That's our case. Thank you.
Thanks so much, Christine. It's so wonderful when the case dovetails like that with the didactic presentation. Well, there's certainly quite a lot to unpack here. I want to thank you for such a great overview of the organization and its goals and its strengths, and especially for your honesty about the current challenges facing the organization in terms of financial sustainability. Let's open up the room for some broader discussions. Any questions for Christine about the case she's presented today?
Christine, do you have direct billable services that you're doing, or is it all grant funded right now?
It's all grant funded and donation funded.
Okay, and do you have contracts with other organizations to provide your services to them? And so getting anything like that, or again, all grants, right?
We only have memorandums of understanding. So we do have community agreements, but nothing for funding.
But no, yeah, they're not actually paying you. Okay.
Lesley, I'm going to pick your brain a little bit. What raised that question? Give us some
So I always think, right, one of the things that we always need to consider is diversifying how our monies are, how they're coming into our organization. What does that look like? So fundraising is one part, which they already do a little bit of that. I heard something about that. Also having another for grants and having a bucket related to that. And then looking at what are those services, and kind of going back to that original thought, as I noted before, is what are we providing? What are we providing to the community, to our patients? And are any of these things something that we can either contract with other agencies related? What is the pricing that would look like? Can we do direct billing with any of it? So if you're doing even case management, sometimes that is fully billable, and that could be a service part that you're doing. But what are you fulfilling that you could diversify some of the money? I also think it would be really great to consider, you have some good wants, right? So many organizations want that same thing. So I think it's very good, and it's a great mindset to have. We want to build our organization and grow. So our not only the community is supported, but our organization, our employees, everybody in here feels supported, right? I'd also want to say, have you done the financials of what that looks like? Have you gone through and really built, if we're going to provide that, how much is that going to cost? What would it look like to have solid, right, benefit packages, solid time off, provide a higher, amount of, pay for the people, or a salary, like what would that look like? What are we really going to be doing? And then having that, like outlet, you can do a pro forma on that, and then build it and say, okay, well, we know we want this. That's, 2 million more than we're getting, And so, okay, so then what's realistic? Okay, well, if that's 2 million more, is it realistic that we can say we are going to be really targeting $100,000 growth every year? That might be more realistic. So that in 10 years or 20 years or whatever it might be, we're going to be there, And so doing some systematic planning, even on the focus of just what we want, to see what that really looks like realistically, is really important too, because there's also maybe other ways you can meet that goal without all of the costs involved. So a lot of times I've seen organizations even think about things like benefit packages and all of those, and then they had partner organizations that are willing to give them all of that. are willing to share resources and work on how they actually organize their employees. So they have, especially if you have memorandums of understanding, you can actually grow those in other ways. So there's might be other ways to really consider, but really putting the time to do the growth look. That's another recommendation if you haven't done that yet.
I wonder, just thinking through that too, Lesley, you made the point early on in your presentation about mission focused. And I wonder, is there anything in your mission or the philosophy or the way in which your organization is structured where you can't bill? Is it intended only for services that are free and built from a community sort of, or statewide initiative? Because if it is, then is there a way to change that philosophy or the mission of that?
And that's a really good question, Kathy. I think it was intended to be that way initially. And now, and I appreciate what you said too, Lesley. Now we're talking to like DWI court and drug court, and we're offering services on a continued basis. One coach that's like assigned to that organization who's just doing that. And then we have all these other people that are asking for referrals. And so, I mean, I don't know how to go about asking for funding or what to do in terms of seeking funding from these organizations.
I was just thinking about the experience when I was a kid, and I used to have to help my dad fix stuff, and he was, very mechanical, and he'd sometimes ask me for tools, and I didn't know what those tools were, right? What is that? Eventually I learned them, but sometimes you're in a position like you're in, which is people will maybe say, here's a tool. Well, I don't know what that tool is. And then to think about who in your community might be able to support you in terms of some kind of consultation, who is external to your system. You have your expertise, and I'm always waving the flag about the value and importance of peer support and how important it is to think about how preventive what you do is of other more expensive services. And hopefully we'll all get there eventually where we truly value, that and pay for it as a way of showing the value. So back to that question, have you ever thought or worked with anyone else who might be able to help you to do some of the things that Lesley was describing and talking about?
Well, I mean, we do have an accountant, and we have people who have come in to do special, talks about finance and things like that. They might be a good starting point at least, or, Be Well, helps us with a lot of things. And so, looking back through the slides from earlier would definitely be a really good starting point too. Additional research and time.
Yeah. What
Yeah.
you might want to look at also, Christine, is within your own organization, as Matthew just mentioned, getting a group together that can look at, are there opportunities to explore within the communities that you already work with? For example, maybe with the county, maybe with the city, maybe with the drug court. Explore the possibility of setting up contracts with them for the services you provide, and showing the value by showing how the outcomes for the participants of these programs are going to be a benefit cost-wise to that city, to that county, because it is going to help keep them out of the local jail, keep them out of the local ER. And all of these come at a huge cost to these communities. So the dollar will catch everyone's attention. So sometimes it's looking and kind of being very strategic and presenting it in a way that you're going to have a captive audience. And what better way? I mean, let's be realistic. it's going to be the cost savings. And not only that, but also the benefits of the much better health outcomes for the participants of these programs, health-wise, employment-wise, staying out of the legal system. There's just, you know, keeping them engaged with their families so there isn't child protective services involvement. Just some examples. I know that's something that I have done in the past. And if you're able to present a case and show via what you are already doing and show the benefits and how much better the outcomes are for participants, you're going to get their attention. And that's the way to possibly get a contract.
Great suggestions, B. And my apologies for missing you earlier in our introduction, another member of our hub team. Rich, I've seen your hand up.
Oh, well, yeah, I think B took some of what I was going to say, but at the same time, I've seen organizations, Christine, by the way, you guys are doing some great work in El Paso. But what I've seen some of the organizations do to kind of expound on B's point is to show those cost savings, like in your emergency rooms or your clinics or your hospitals, where individuals that you're working with, it may have been a high frequency visitor or someone to a ER department or clinic, where you can show the savings. Those individuals are no longer that high frequency user of their services. So you can talk about those savings. I've seen too, another organization that connected to a lot of the clinics. And I know you're an RCO and you don't provide clinical services, right? But it may be connecting to the IOPs or the residential services where individuals are working with peers, and then they have higher retention. There's a number of aspects that come from that. And then they then could possibly help support or provide some assistance for your peer support. And like you said, just developing those contracts and working with areas in the community where they're benefiting from that service. So, yeah.
Great. Thanks, Rich, so much. And before we go to wrap up, I just want to open it up any other peer organizations on the call today who recognize who've been in this same stage of development and have grown beyond it, want to share any experiences or strategies, tips they found useful. And Adrian, thank you for throwing over in the chat some more ways for quantifying impact, quantifying the return on an investment for a program like this.
One quick suggestion I would add or idea is that of many of the peer programs and organizations that I've worked with, there is this kind of push-pull because you're seeking to have more independence and to make sure that what you're doing is peer-driven, peer-led. And then sometimes the partnership with other organizations has that point of tension and worry that, you know, some other non-peer support is going to kind of take over what we're doing. And we're working so hard toward independence. And so I appreciate that can be sort of a dilemma to kind of, and to find sort of a trusted partner who will honor what you do as a peer support and will partner effectively with you in helping you and giving you some of those resources that you might not have internally. So I know that's the challenge in terms of kind of interviewing potential partners. Do they value who we are and what we do? Great
comment. And thank you, Lesley, for sharing over there. Just the realization that other organizations are paying for these services, that can be pretty empowering too. Well, we're coming to the end of our hour, and Kathy, you have the task of summarizing some of the key points from our conversation today.
Well, okay. I've heard the story many times from Lesley, but I still love to hear it one more time. So I always learn something again. She is, and you have to keep hearing it over and over. So if you felt like it was a lot, review the the video many times, and you'll start getting it. So the main points that dovetail with this case from her presentation, really look at your organizational structure, your mission, take those 5 steps and break down and audit your what you can bill, what you're licensed to do. So there's a lot of things to do that. Build a planning pro forma, get those strategies for value and outcomes going, align those, make sure that they're aligned with the your mission. Diversify and look for look at your goals and build realistic plans around those goals by looking at also larger system strategies. You may also want to look at the structure of your organization and reevaluate what it was started to be and what it could be now, looking long term. Consider consultation, both internal and external. Get those groups together to explore like financial potential contracts, financial planning processes that you already have in place, reevaluate those. And then focus on cost savings and outcomes when you're strategizing ways to show value to your community partners to get those contracts. I hope that kind of got high points.
It certainly did. Thanks for the summary. Thank you all for such a great session, Lesley, for the wonderful didactics, and Christine for the honesty and the case and the feedback you shared with all of us today. So thanks everyone for joining. As a reminder, look in the chat for that link for the post-session survey to get your credits and enter that free drawing. If you'd like to present a case at one of these echoes, please just email the Be Well Texas team. That link is over in the chat as well. We look forward to seeing you at our next session on Thursday, October 27th. Have a great rest of your day and rest of your week. Bye-bye, everyone.
Bye, everyone.
Thanks, everyone.